The city-county relationship has never been stronger. There is a long history that many of you all have lived through, and that is in the past. Today we have a city and county government aligned. We are moving together. We are talking. I think the mayor and I probably talk every single day about. Our teams are talking. We're working. We recognize the critical and urgent need to do more around homelessness, but we also recognize the critical and urgent need to do things differently. It's not just a matter of doing the same thing that we've done. We have to explore new ideas, new opportunities, new ways. We know the impact, both for those who are experiencing being unsheltered and the broader impact around downtown and countywide. And at the county, we are taking efforts around homelessness that address the entire county, but we focus in those areas where we know the problem is most prevalent and highest, in particular areas like the downtown. And I appreciate tremendously the mayor's leadership. I appreciate this mayor. I appreciate his willingness to be collaborative, to get us all together, to sit down and talk about all of the things that we can do. And both the city and the county are dedicating substantial portions of what they received in their ARPA funding towards homelessness and behavioral health solutions. With that funding, we're able to invest in better ways to reduce the number of encampments and in helping fill a void in our current service delivery model. And I want to talk for a minute about an effort that the county is working on in close coordination with the city to augment everything else they're doing to meet what we see as a gap, an area where we need to step up and do it a little bit different. And while each person experiencing homelessness has their own unique set of circumstances, both addiction and mental health injury are common contributors to chronic homelessness. Our new community harm reduction teams, which we affectionately refer to as CHART, and low barrier bridge housing programs. Both of these set to launch in August will provide a better way to support this population and an array of services that is presently not funded at the level it needs to be and doesn't exist where we need it to exist in order to have a significant impact. A chronic homeless person with co-occurring disorders, suffering from both mental health issues and substance use issues, needs very specific services, very specific approach, very specific sheltering programs. And a lot of the normal things that the city and the county have done in the past simply don't focus in on approaching these folks in the right way, with the right care, at the right time, and giving them the right options. Instead of just throwing money at a problem using the same model and expecting a different result together, we're beginning to switch the game plan a little bit to try something a little bit different. So many shelters and housing opportunities for homeless individuals now require you to be sober or actively committing to sobriety. And we need to provide opportunities to get folks into housing, to get them into a place where they can get that without condition. Many of our service providers who do incredible work, and I want to echo everything the mayor said earlier about the tremendous work that our folks are doing on a daily basis. But these folks need help. They need more resources. They need more assistance. And so what we want to step in and do with our CHART program and with dedicated housing for these is have unique and dedicated resources for some of those cases that are the very most difficult, that are the hardest individuals out there. When a person is suffering with addiction and mental health issues, it's not just a matter of getting them a meal, a cot, a roof over their head. That may not be enough to get them to come inside. And if we're being honest, there are some amongst this population who don't trust that they will actually get the unconditional, non-judgmental help that they really need. Many of these individuals who remain on the streets night after night, resistance to choosing a life of sobriety and supportive surroundings, are often cycling in and out of our jails, creating more barriers to recovery, an inability to build that trust, an inability to feel seen as a human. But that doesn't mean we give up on them. It means we need to work smarter. We need to find new, better ways to meet them where they are. And we think our community harm reduction teams, paired with housing opportunities for these individuals, will help augment and complement so many of the other efforts that are moving forward. Community harm reduction teams are trained to engage this very specific population. These outreach teams include substance use counselors, peer support, mental health clinicians, and psychiatric consultation with nurse practitioners. They are trained to engage specifically with some of the most chronic and most severe individuals, to build trust, to meet them where they are. Provide them with resources like naloxone. Provide them with harm reduction resources like syringe services. Keep them safe, talk with them about the harms of using substance, but offering them a path to go forward in a supportive and collaborative way. These teams will also provide referrals to both primary care and behavioral health services, medication management, and medication addiction treatment. The community harm reduction teams will also connect them to low barrier and immediate access bridge housing, including short-term and safe haven housing consistent with best harm reduction practices, where clients can then be connected to permanent supportive housing, which we know is greatly needed throughout the region. Over time, with persistent engagement, persistent supportive engagement, we expect to achieve better outcomes with this strategy because it is a best practice designed to reach this very hard to reach subset of our homeless population, people that are experiencing chronic homelessness. The goal is to get them off the streets, engaged in services, and we know get them on a path to true treatment for many of the issues and challenges they face. To make this new initiative a success, it takes both of us, the city and the county, along with all of our partners, and many of them are here today. The County of San Diego, in our recent allocation of our ARPA funds, dedicated $85 million to help address issues facing the homelessness. But it is not just a question of money. It's not just about more money. It is about spending that money in a new way, bringing in new intensive programs and services, trying to reach, again, those hardest to reach individuals with a different approach. And so we will be funding the CHEART teams along with the behavioral health and supportive services. We will also be working to expand safe haven sites and bridge shelter sites, and working again with our city partners and with all of our providers to not just have the engagement teams, but have an individual and a place for these to go. And I appreciate the city's commitment. I want to thank the mayor for what they are stepping up to fund, for everything that they have going and the commitment that they bring. And in closing, just let me say again, addiction and mental health injury are common contributors to chronic homelessness. If you have been homeless for any significant amount of time, you no doubt experience trauma that compounds those challenges and it compounds those problems. And it's easy to understand how someone gets to a place where there's not trust, right? There's not an ability to say, well, if I just go into that thing, it's all going to be okay. And so for some of these individuals, it takes a different approach. It takes dedicated resources. It takes a special focus to engage, to build trust, and to have a location that they would be interested and willing to go into. And so one of the things we're doing, in addition to everything the mayor outlined as a county, is focusing again on these CHEART teams and dedicated spots for these individuals to go. And so we're thrilled as a county to join the mayor in these efforts, to join the Regional Task Force on Homeless, the Downtown Partnership, all of the service providers that you see here. We recognize we have to do more. We recognize the severity of the situation we face, and we recognize that the need for action is here, and we recognize that we will also be held accountable for the impact of our efforts. We also recognize that this problem did not create itself overnight. This is a problem that's been generations in the making, and so we move with a great speed and with a great focus on trying to do it. But we also recognize launching new programs with new staffing and new people, and all of these never go quite as quick as we want, but we are moving as quickly as we possibly can to be of assistance. So thank you, Mayor, for all of your efforts, and to your team and everyone who's here, and the county is thrilled to be a partner with the city. Thank you.